Stephanie. I'll be your nurse practitioner today.
Nice to see you.
Nice to see you too. I'm just going to wash my hands over here.
Okay.
So today we're going to be doing a focus exam on your abdomen.
Okay.
First I'm going to check your axillary lymph nodes. So if you could just give me your hand, just keep it nice and relaxed. Just checking for any tenderness, so please let me know if you feel it. Just going to start with the central lymph node, then moving laterally, then the pectoral lymph node, then the subscapular lymph node, and the epitrochlear lymph node. Any tenderness here?
Nope.
Okay. Lymph nodes are non-tender and non-enlarged.
Okay.
Same over here. Central, lateral, pectoral, subscapular, and epitrochlear.
Okay.
So good on both sides. All right, so I'm going to have you lay down for me so I can take a better look at your abdomen.
Okay.
Please lift up your shirt. Perfect. Okay, so just starting with inspection, your skin is homogeneous, symmetric on both sides. I don't see any scars, lesions. Looks good. Coming from down here, the contour is flat, which is totally normal. I'm going to have you bend your knees up for me, okay, and just lift your head up briefly. I don't notice any hernia present. It looks very healthy and normal, so you can relax your knees again.
Okay.
I'm going to move on to test the reflexes of your abdomen. And I'm going to start with T5 to T7, T7 to T9, T9 to T11, and then coming from your groin area, T10 to T12. And I'm going to check on both sides. Okay. And I see ipsilateral movement of the abdominal muscle. And the umbilicus is moving towards the side that I'm reflexing to that area. So it looks normal. So next I'm going to listen to your bowel sounds. Okay. I'll just try to warm it up a little.
Thank you.
Okay. Good. Bowel sounds are present in all four quadrants. There's a loud gurgling noise, which is totally normal. Now I'm going to listen a little bit more deeply to your aorta. And your renal arteries. Now moving to your femoral arteries. And I don't hear any bruits at all. Your femoral arteries have a strong pulse. And then I'm going to listen for any venous hum. And I don't hear anything, so it sounds good.
Great.
Okay, so moving on to percussion. So put my stethoscope down. I'm going to start just percussing your abdomen. And I hear tympany throughout, so that's good. Next I'm going to percuss the liver border, the span of the liver. So I'm going to move from an area of tympany to dullness, and same from tympany to dullness so I can measure the span of it. Okay, I'm coming from this way. So about 7 centimeters, which is completely normal.
Okay.
Then I'm going to also percuss the spleen. Okay, so it's nice and dull. And I'm going to move over to the left mid-axillary line, and here I hear tympany. I want you to take a deep breath in and release. Okay, and tympany is present, so you have no splenomegaly, which is completely normal.
Okay.
Okay, now I'm going to move on to palpation. Please let me know if you have any tenderness. I'm going to start with a light palpation. Okay, and I don't feel any masses and seems to be non-tender. Now moving to a deep palpation, a little bit deeper, about 5 centimeters. And same thing, no masses or tenderness.
Okay.
So now I'm going to palpate the liver. If you could take a deep breath in and exhale deeply. Okay. So the liver is virtually non-palpable. I may feel a slight border, but it's really healthy. And going on to the spleen. A deep breath in and exhale. And the spleen is non-palpable, which is completely normal. Now I'm going to palpate your aorta, and it's up to the left a little bit, midline, and it's about 2.5 centimeters, okay, with a pulsation anteriorly. And now moving to your groin area, inguinal area, I am going to palpate your lymph nodes horizontally and vertically, and same over here, horizontally and vertically. Any tenderness?
Nope.
And those are all perfectly great, non-tender, not enlarged at all, which is normal. Now I'm going to just assess, do some tests on your abdomen. I'm going to start with the rebound tenderness and let me know if you have any abdominal pain in the area.
Okay.
Any pain?
Nope.
Okay. The next few tests I'm going to do demonstrate irritation of the appendix or appendicitis. First, I'm going to do the iliopsoas sign, and I'm going to have you lift your right leg up. And as I push down on your thigh, please push up. Great. Any tenderness in your right lower quadrant?
Nope.
Okay. Now the obturator sign, if you bend your knee up, lift it for me, and I'm going to just push it inward. Any tenderness in the right lower quadrant?
Nope.
Good. So that's normal. Also the Rovzing sign. Please tell me if you have tenderness in the right lower quadrant.
Nope.
Okay. And last, I'm going to assess Murphy's sign, which will assess for gallbladder irritation or enlargement. Same with liver
Okay.
inflammation. So take a deep breath in. Okay. Any pain here?
Nope.
Okay, good. Very good. Thank you.
All right.
So lastly, I'm going to do a rectal exam, and I would
Okay.
put your feet in stirrups as you lay supine, just kind of like a vaginal exam, but I'm going to put gloves on, lubricate my finger, and insert it in your rectum and press down on your pelvis to see if I can feel anything abnormal.
Okay.
Okay?
All right.
All right. Thank you so much.
Thank you.
Have a good day.
You too.